Hi, I'm Dr. Martin Rutherford, and we're going to talk about idiopathic peripheral neuropathy today. We're going to spend a few minutes defining what idiopathic means, because we treat a lot of idiopathic peripheral neuropathy. At least that's what patients come in with as far as a diagnosis. I'm a certified functional medicine practitioner. This is my partner in crime, Dr. Gates, board certified chiropractic neurologist. And together we've put together a couple of disciplines that have been pretty successful overall in treating chronic pain and chronic disease, and unbeknownst to us that our practice would develop into having certain clinical conditions overwhelmingly come into us, and peripheral neuropathy is one of the biggest conditions, one of the conditions that we see most of the time. And idiopathic, and for those of you who might have been also told that you have cryptogenic peripheral neuropathy, kind of has the same meaning. It means they don't know what it is.
Exactly. Unknown cause.
Unknown cause. I'm sorry. That it's an unknown cause. That there are actually a lot of peripheral neuropathies that supposedly have no known cause. Mm-hmm. And I don't know if you want to get into that a little bit.
I do. It's an important point. Just because it varies, between 50 and 35% of neuropathies are unknown, cryptogenic. Just know that they're probably cryptogenic because your neurologist may be hamstrung by the insurance industry in terms of how many tests they can really order. Otherwise,
how many diagnoses they can actually make.
Right, because otherwise, we've experienced this with diagnostic testing. You've experienced it, where basically, when you're contracted with an insurance company, you can do certain tests, and you can't do certain tests, and certain tests won't be covered. A good reference to look at is Dr. Dick, or D-Y-C-K is how it's spelled. You say Dyke, but he's out of the Mayo Clinic, and he did a study where he said, really, of those 50% that are quote-unquote idiopathic, he was able to figure out 76% of them when testing was available, when ample time was available. Right. So this is no cut on your neurologist at all. What you need to know is lots of times if you've been told it's idiopathic, it's probably because the insurance industry is limiting the number of tests you can do. And that's the fact of the matter. So relative to what the potential causes are, and knowing now that we cited that study where your cause may be actually able to be figured out in the right setting, with the right testing, with the right amount of time. Pre-diabetes now is being acknowledged as a major cause of small fiber neuropathy, and it wasn't acknowledged before really 2006. And even now, a lot of people are not even aware that it can cause peripheral neuropathy. Gluten problems. Oh gosh, I just saw something in Time yesterday, Time magazine, where they said, eat more gluten. There's this continual war regarding gluten that we've done broadcasts on, but just know that some authors have cited upwards of 33% of you idiopathic peripheral neuropathy patients have peripheral neuropathy secondary to a gliadin intolerance. You don't have to have celiac disease to have what's now being referred to as a gluten-related disorder, one of them being peripheral neuropathy.
Gluten-sensitive peripheral neuropathy.
Yeah, big
gluten
one.
Ataxia.
Gluten ataxia, a huge
inability to walk from it. Documented, well documented.
Well documented. If you need more research on that, look up Dr. Hajivasulu out of the United Kingdom. He has done over 100 articles on gluten-related disorders neurologically. Nutritional deficiencies, our favorite. So for those of you out there who have problems with your gastrointestinal tracts where you don't absorb things, you have frequent diarrhea, you may have celiac disease, you may have irritable bowel disease, or inflammatory bowel disease like Crohn's or ulcerative colitis, irritable bowel syndrome.
Pretty much if you've had a bad bowel for like 6 months or more,
then you may have a nutritional deficiency.
You may have a nutritional deficiency.
Especially relative to vitamin E, copper, the B vitamins 1, 6, 9 to a certain degree, and definitely 12. And then also alcoholic peripheral neuropathy is something that needs to be attended to for those of you out there who drink in excess of, I think the estimates are 100 grams a day for 10 years. You can develop alcoholic peripheral neuropathy independent of a vitamin B1 deficiency or with a vitamin B1 deficiency. A medication review is critical for all of you idiopathic peripheral neuropathy patients. We have an extensive list that we have patients check off whether they've taken XYZ, ABCD, EFG medications. And those medications, certain medications can cause peripheral neuropathy, and that has to be thoroughly investigated. Some of the common ones, we've seen one which was metronidazole, which is Flagyl, used to treat things like diverticulitis. Unfortunately, we had a patient who was on that for a couple years when they shouldn't have been, and when taken for a long period of time can result in peripheral neuropathy. Things like colchicine, which is used to treat gout, if administered chronically, can cause peripheral neuropathy. Statin medications have received a lot of attention, and it's highly contentious. The estimates vary on statin-related peripheral neuropathies, but just know that some estimates, we did a whole 5-minute talk on this, cited that those who take a statin may have a 1,400% increased chance of developing.
It doesn't seem to be contentious in the literature. It seems to be contentious
in clinicians, because doctors are tired of patients coming up saying, I don't want to take my statin, I don't want to take my statin. Right. So lots of times we just feel that this issue is kind of brushed to the side.
Right.
Paraproteinemias, those are a fancy word for another fancy word termed monoclonal gammopathies of uncertain significance and other myeloproliferative disorders. What that means is certain types of bone cancer can result in peripheral neuropathy, right. Multiple myeloma being one of them. And there can also amyloidosis, there can also, which is not a bone cancer, but it's a condition within this heading of paraproteinemias. Also know there's this thing called monoclonal gammopathies of uncertain significance. Basically what happens is the immune system produces...
Can you say that a little faster?
Monoclonal gammopathies of uncertain significance.
Now you know what he's talking about.
Basically, it's where the immune system makes immune cells unnecessarily. There's no cancer, but those immune cells can be targeted to peripheral nerves, and they're saying that upwards of 10% of you idiopathic peripheral neuropathy patients have monoclonal gammopathies, and you need to be tested for them. So you can talk to your doctor about those. Heavy metals, we just did a whole thing on mercury. We'll do something on lead soon. They can cause peripheral neuropathy. Toxins, organophosphates. We do have a patient right now who is exposed to organophosphates and developed peripheral neuropathy. Secondary to that, we talked about alcoholism. Liver and kidney disease can result in peripheral neuropathy, usually end-stage liver and kidney disease do that, as well as critical illness, people who are really sick, who may have some severe COPD. They just can't get enough oxygen in their body, and they can develop peripheral neuropathy. So that's not all of them.
No,
and we haven't even gone into dysimmune conditions. I mean, right. All the autoimmune conditions can be associated with peripheral neuropathy as well.
Yeah, I'm doing a talk locally tomorrow on peripheral neuropathy, and in the talk, I'm going to make the argument based on research, based on studies, based on what I've seen, based on the clinical neurology, the peripheral neuropathy clinical neurology series that comes out every year, put out by the American Neurological,
American Academy of Neurology.
American Academy of Neurology, is like the Bible. That there's actually over 80 causes of peripheral neuropathy. When you're told it's cryptogenic, it means it's not diabetes, it's not your neck, it's not your low back, it's not your ankle. That's pretty much it.
Yeah.
It pretty much means if they have checked those things and it's not those things, then the take on it out there, and a lot of you heard this from your doctor, 50% of it's diabetes, a small percentage of it is low back, ankle, neck, spinal type of things, and the rest is cryptogenic. The rest we don't know what it is. Dr. Gates just went over just a part of what the cryptogenic causes can be, and so just know that if you're told it's cryptogenic, it just means you need to do more research, because there is a reason for your peripheral neuropathy. It's been researched in the medical profession. As Dr. Gates so delicately put it, there's just a system out there right now that's kind of controlling the way that things are done relative to these chronic diseases, and it's an acute system, and that system entails you getting a diagnosis, you getting a code that says, here's the code for peripheral neuropathy, that goes to the insurance company, and the insurance company basically dictates what can be looked for, and so that's cryptogenic. Cryptogenic is all the things that can't be looked for, and so you just need to keep looking, and there's usually a discernible cause. There's usually a cause that can be uncovered with a good history, with a good exam, and with the understanding of what is in the literature out there, which is cataloged voluminously every year. So we're not making this stuff up. This is stuff that you need to know. So, good job. I think that covers it.
Yeah, I think so.
If you have any questions, you can contact us at powerhealthtalk.com. or like us on Facebook.
Exactly.
And I don't know very much about Facebook, so I hope that's helpful, and I hope that you are accessing our other our other talks on peripheral neuropathy, if that's something you're interested in, because it's a big subject, and we're doing our best to cover all of it for you. So until next time, hope this was helpful. Let us know what you think.
Thanks for watching.